Hello, my name is Lisa Sanchez Meraz, and this is my informative speech. Before I begin, I just want to begin to thank everyone for coming here and allowing me to start a conversation about the effects of smoking in our bodies. Now proceed to begin. As I was walking down the hall, I was hearing gasping, gagging, and choking sounds coming out of my patient's room. My patient, a 70-year-old male who suffers from COPD, also known as chronic obstructive pulmonary disease, and has a tracheostomy tube, was choking on his own pulmonary secretions. As nursing students, we are able to see the consequences of smoking firsthand, and it's very eye-opening. The CDC, also known as the Center for Disease Control and Prevention, states that 34.2 million Americans smoke. Smoking has tremendous effect in our body and can cause cardiovascular, respiratory, and reproductive disorders. Although smoking affects all of the body system, one of the major body systems that it affects is the cardiovascular. The hearts and the vessels in the cardiovascular system help bring oxygenated blood to all of our organs and tissues, and is severely damaged by smoking. One of the ways that the smoking affects the heart is by making the person who smokes more susceptible to have coronary heart disease. And this disease, the vessels in the heart narrow, making blood flow decrease and not allowing all of the body to get the oxygenated blood that it needs. Coronary heart disease is the leading cause of death in the United States, and it could be easily prevented by leading a healthy lifestyle, which includes not smoking. A second way that the smoking affects the heart is by making it susceptible to build a plaque inside the heart. This can increase the risk for clots. Clots are very dangerous because they can cause myocardial infarction, which is also known as a heart attack, or stroke, which is when the clot gets stuck in a vessel inside the brain, which doesn't allow blood flow and can cause many neurological dysfunctions. Not only does smoking affect the heart, but it also affects the lungs. The second major system that smoking affects is the respiratory system. Smoking affects the respiratory system by affecting the airway and the air sacs inside the lung. COPD is the leading condition that is caused by smoking. Chronic obstructive pulmonary disease, it consists of chronic bronchitis, which is a condition where a lot of secretions and copious amounts are produced in the lungs, and emphysema is where the air sacs in the lungs are damaged and doesn't allow gas exchange to occur, making the chest appear larger, but the patient is unable to breathe. A second way that the smoking affects the respiratory system is by making the patient more susceptible to lung cancer. Lung cancer occurs because cigarettes are considered one of the highest or deadliest carcinogens. A patient who smokes is 12 to 13 times more likely to get lung cancer in contrast to a non-smoker. A third way that the smoking affects the respiratory system is for patients who have asthma. To persons who have asthma, smoking can trigger asthmatic attacks, which makes them harder to breathe and also can increase the degree of the asthma attack, making it worse and more frequent. Not only does smoking affect the cardiovascular and the respiratory system, it can also affect the reproductive system. Smoking has severe consequences, especially during pregnancies. This can include stillbirth, which is when the baby is born dead, ectopic pregnancy, which is when the embryo is growing outside the uterus. It could also lead to premature delivery, which is when the baby it's not fully developed, but the woman goes into labor, and sudden infant death syndrome, which is when the baby it's completely healthy, but the infant suddenly dies. Not only does it affect the female reproductive system, but it also affects the male reproductive system. One of the ways that this affects the male reproductive system is by making this active sperm decrease, which can lead to infertility. This can also lead to miscarriages and birth defects. These are just some of the major systems and conditions and diseases that can occur because of smoking. It is important to remember that leading a healthy lifestyle and having healthy habits would ensure you to have a better quality of life. After I ended suctioning my patient, he began to tell me how he picked up the habit when he was about 20 years old to start smoking every day, and he did that for 50 years. And that's why he has a tracheostomy tube, and that led him to many health issues, and that he regrets the day that he began to smoke. Every time I think of having bad healthy habits, I remember of his story and why it's important to make good choices about the habits you have and how can they affect your health. In conclusion, we should keep in mind always the effects of smoking to our body and treat it as right as possible, because although we may not see the consequences at the moment, we're gonna pay them once we get older and our immune system starts to deteriorate in our body as well. Thank you all for having me here and letting me teach about the consequences of smoking. Thank you.